Hello everybody, good afternoon. Welcome to the Council of the Americas for our program this afternoon on the coronavirus, COVID-19, and its impact on the Western Hemisphere, Latin America, and the Caribbean. My name is Eric Farnsworth. I'm the head of the Washington office of the Council and delighted to be your host for what promises to be an outstanding program this afternoon, covering some issues that are very relevant and certainly of concern to each one of us today. For those who don't know us, the Council of the Americas is an organization whose members share a common commitment to economic and social development, open markets, the rule of law, and of course democracy across the Americas. We're a leading voice for the private sector's role in creating healthy futures for the region, and today is just one example of how we continue to bring together thought leaders from governments and multilateral organizations to advocate for the health and well-being of all citizens across the hemisphere. This event, as all of you know, is timely, considering the need for a strategic and coordinated international response to what is essentially an international crisis. Just yesterday, in fact, Dr. Tedros, who is the Director General of the World Health Organization, announced that COVID-19 is now classified as a pandemic. He urged local and national governments to act and stressed that all countries can still change the course of this pandemic, that in fact it's the first one that can be controlled. It requires, however, prevention, preparedness, and indeed political leadership to support a strong public health response. And of course, the impact of the coronavirus will go beyond and is already going beyond the physical health of all of our communities, and it's having a far-reaching economic impact across the Western Hemisphere as well. To address these issues, we're honored to bring together a true panel of experts to discuss their organization's response and their views about the region's response to the coronavirus, and provide recommendations for innovative and creative ways that governments and NGOs, multilaterals, the private sector, all of us can collaborate to address future public health threats, current threats, and indeed lessons that we can implement going forward. Today's program, ladies and gentlemen, is part of the Council's Healthcare series, which is aimed to address the challenges and growing opportunities in healthcare across the Americas and to promote dialogue on innovative and sustainable healthcare in Latin America and the Caribbean. We continue to convene health leaders from across the hemisphere to discuss the most pressing issues of the day. I'd particularly like to thank our sponsors of the series who indeed make these issues possible: Sanofi, Pfizer, Merck, and Roche for their support, and I'd also like to thank Zoe Douth, who coordinates these issues from our staff here at the Council in Washington. We've provided the speakers' biographic information to all of you on our website, which is www.ascoa.org. And so we encourage you for additional information on each of our speakers to refer to that to the extent you care to do it. But because the reason why you're tuning in online to listen to this is not to learn about their biographic information, but to hear from them, we want to get right into the panel. So let me introduce our outstanding panelists. I'll give their name and title and affiliation, and then they will have some comments to make concerning the coronavirus that we face today. Dr. Jonas Barbosa da Silva Jr. is to my immediate right. He's the Assistant Director of the Pan American Health Organization, obviously the organization that covers these issues in the Western Hemisphere, does a magnificent job in very difficult circumstances across the region. Dr. Amparo Elena Gordillo Tobar is Senior Health Economist at the World Bank, and she's responsible for coordinating the World Bank's response for coronavirus in Latin America and the Caribbean. Dr. Nelson Arboleda is the Director of the Office of the Americas in the Office of the Secretary at the U.S. Department of Health and Human Services. And of course, Dr. Inez Bustillo is Director of the Washington Office of the United Nations Economic Commission for Latin America and the Caribbean, ECLAC, or CEPAL in Spanish. You will recognize each one of them because each one of them has in the past been invited to this table and indeed has participated in our activities, and we're delighted to have each one of you back. And the final note that I would make is we have a slightly different format today. We are webcasting only. There is no live audience in this room, and the reason why we're doing it is because we do not want to be accused of spreading coronavirus while we're talking about coronavirus. So we thank each one of you for indeed tuning in via webcast. Dr. Barbosa, you have you are dealing with these issues in real time. As a representative of PAHO, I think it's appropriate to begin our conversation with you. Thank you for joining us, and we'll turn it over to you for your comments.
Thank you, Eric. Good afternoon, my colleagues of the panel and the virtual audience. We have the situation in Latin America and the Caribbean. I think that we have some difference among the regions in the world. We had the first case reported by Brazil, the February 26th. Since then, until yesterday night, we have already 19 countries in Latin America and the Caribbean that reported cases. These are imported cases and what we call secondary cases that are related to the imported one. In no country in Latin America and the Caribbean until today, we have not yet detected the widespread community transmission. So what can we expect for the new weeks? First, that we will have more cases. We expect also that the countries need to keep the strategy that they have trying to contain the spread, so they need to try to identify the contacts, the cases, the contacts, to put them in a proper isolation, to all the measures that they need to implement trying to contain the spread. But at the same time, they need to be prepared now for a possible scenario that they will face widespread community transmission. When the scenario changes, they will need to adapt very fast to a new strategy where the main objective is to save lives. So they will need to protect health professionals because they need to keep the health services going on and providing health care. They need to provide to the hospitals all the equipments that they need to provide care. They need to have the primary health care provide information. One aspect that is very important is that so far, with the information that we have, more than 8% of the cases will be mild cases that will not request hospitalization. But in around 16 to 20% of the cases, we can have more severe presentations of the COVID-19, and mainly for people over 60 or 70, and that they have a chronic condition such as hypertension, diabetes, cancer. They are at high risk to develop pneumonia related to the virus, and some of them will require ventilation, intensive care units, care, and things like that. So it's very important to be prepared. We don't have a very good estimation about what will happen and what are the figures that we expect, because some conditions are not yet well known. We don't know yet if this virus will have a similar behavior as influenza and other respiratory viruses that have a seasonal behavior. So I think that it's better to prepare for the worst case scenario. So we are calling the attention and highlighting to every country in Latin America and Caribbean that all the measures that they are implementing in airports or surveillance system, strengthening surveillance system, identifying the first cases, this is important because it can not probably prevent 100% that the country will not have transmission, but this can delay the transmission. And 2, 3, 4 weeks, I think that is important to strengthen the preparation of a health service. I think that every country will also need to make a decision based on the epidemiological situation that they have to adopt some non-pharmaceutical measures, like we say, or social distancing measures, things like mass gathering events, classes, teleworking. This is very difficult to have a general recommendation for the region, because what we need is that this can work, and the situation in China provided a very good evidence that they can work, not to interrupt the transmission, but to reduce the the speed of the transmission, so the health service will not be overwhelmed with many cases at the same time. But you need to be very careful because this has a social and economic impact, so you need to have a proper balance between the one extreme that is to consider that it's just a flu. No, it's not a flu, but at the same time, it's not a deadly pandemic that we are facing. So I think that every country needs to have a very careful risk assessment about their situation and to adopt the proper measure. But the general recommendation, be prepared for the widespread transmission, prepare health service now, because no measure at the airports can avoid completely the risk to have widespread community transmission in the next weeks.
Mm-hmm. Thank you, Dr. Barbosa. Let me just emphasize the point you just made. We don't know, indeed, or correct me if I'm wrong, but we don't know whether seasonal changes will cause this to die off on its own, correct? I mean, there is this assumption that one sees all over the place. Don't worry, hot weather countries are not going to have to be concerned about this, and we don't know that to be the case. Is that accurate?
Yes, that's correct, because we need more time of observation.
Yeah.
Because the disease was reported, the first case in the last day of December. So during this period so far, in China, for instance, and in Europe, we have the peak of respiratory virus transmission. So if this virus, hopefully, has the same behavior of influenza virus and other respiratory virus, probably in the North Hemisphere, we will expect a reduction of at least a reduction on the velocity of the transmission. But at the same time, in the South Hemisphere, we will have more transmission during the months of June, July, starting from the south to the north. So Chile, Argentina, and the south of Brazil need to be very prepared. Even in the situation that the virus will behave like the influenza virus, we can expect to have some clusters and some outbreaks in certain settlements, such as hospitals or nursing homes that are very risky, because you have there people that are exactly the more vulnerable group that we have, prisons, schools, things like that. So even in the scenario that the virus will behave as the flu virus, we need to be prepared, because countries can face many important outbreaks even out of the regular season.
Mm-hmm. Thank you for that explanation. Very helpful indeed. Dr. Gordillo Tobar, to you, please.
Yes, good afternoon. Well, thank you for the invitation to the World Bank to participate in this panel. Before my statement, and on behalf of the World Bank, I would like to express my sympathies to the families and the communities that are being affected and will be affected by the virus. We are determined to act and to do the best possible that we can do to reduce the impact in the people and in the economies. It is evident, and for the words that Dr. Barbosa just said, that in our region, countries face different levels of risk and vulnerability to the COVID-19. Therefore, they will require different levels of support. Coordinated efforts and integrated approach should be sought. World Bank is working to provide a fast, flexible response based on developing country needs. We know the disease is spreading widely, as it was explained, and is spreading quickly. In the World Bank, we also see all the other regions in the world, not just the Latin American region. The concept of pandemic, as this is conceived, is when it has spread to more than one region. In this case, the cases has been confirmed by WHO. This is no longer a regional issue, it is a global problem, calling for a global response. We know the outbreak will eventually retreat, but we don't know yet how fast this would happen. We don't know yet how the virus will respond when treatment and vaccine will be available on a scale. We also understand that we are in the mitigation step for Latin America. That means we have to begin to treat the cases, we have to respond. We know the shock is somewhat unusual, as it affects significant elements of both supply and demand. Supply is disrupted due to mobility and mortality, but also the containment of efforts that restrict mobility, and the high cost of doing business due to restricted supply chains and the tightness of credit. Demand is also falling due to high uncertainty and all these effects spill over across borders. What we know from experience in similar crises is that about 1/3 of the economic losses from the disease will be direct caused from loss of life, workplace closures, and quarantines, and the remaining 1/3, 2/3 will be indirect, reflecting the cause of the uncertainty. The impact will depend on the timeliness and effectiveness of our actions, and we will focus on those. In practical terms, what is the response that the bank has placed to the public? The president of the bank, David Malpass, announced 10 days ago a package of $12 million. $12 million that will come from the International Bank for Reconstruction and Development and the International Development Association and the International Finance Corporation. It will also include policy advice, technical assistance, drawing on global expertise and country-level knowledge. In practical terms, what does it mean? It means that the bank is working to bring in virus-related operations forward beginning in March, and speed is needed to respond to the governments in this effort to contain the spread of the virus. In order to do that and to comply with trying to do the best we can, the collaborative effort is working with WHO at the global level and with PAHO in the local level.
Thank you very much. And as a reminder to those who may have joined the webcast just a little bit late, the biographic information of each of our panelists is on our website, and I would encourage you to look at it. These speakers are true experts, and this is a very, very high-level panel, so we would call that to your attention, www.ascoa.org. Dr. Arboleda, to you, US HHS, you're helping a lot in the international region. You're doing the international response in terms of Latin America and the Caribbean. How do you see it from the perspective of where you sit?
Well, thank you, Eric, and Zoe, and thanks to the Council of the Americas for hosting this important and timely event. Saludos a todos. I understand there are thousands of individuals. It is a little rather strange feeling being in this room under the circumstances of these settings, but truly an honor to be part of this panel with such a distinguished group of experts, and of course being here with old friends from many other battles in the public health response realm. There are truly multiple areas or topics that we could discuss in this forum around the overall impact of what could coronavirus bring to Latin America and the Caribbean. But I will focus, Eric, my remarks around three brief or main themes. One, as Jarvis alluded to, the current overall count, so the number of cases currently in the Americas. Two, what the USG, the U.S. government, and specifically the Department of Health and Human Services is doing and is supporting and providing assistance throughout the American region. And finally, how can we best assist our neighbors in Latin America and the Caribbean to get through this epidemic or this pandemic in the modern era. And when currently, as you know, the times of social media, the times of telehealth, telework, etc. But most importantly, maybe for our audience in Latin America and the Caribbean, is the times of WhatsApp. So first, let's start with the case counts. The current situation in Latin America and the Caribbean, similarly to what you're currently seeing here in the U.S., case counts are in truly an increasing fashion. They're changing by the hour or by the minute. We see an upward trend. And as Jarvis mentioned, we currently have about 20 countries in Latin America that have identified and reported their initial cases. We're being somewhere in the region, if we don't count Canada and the U.S., of about 200 cases with, unfortunately, 2 deaths. These include all countries, major countries, Colombia, Brazil, Argentina, and Mexico. And in the Caribbean, St. Martin and Dominican Republic, just to name a few. And as within the last 24 to 48 hours, we have heard, of course, as well, of cases being reported from Bolivia, from Honduras, and from Cuba. At this point, the majority of the cases in the Americas region continue to be travel-related, with the epidemiological links being traced back to those individuals that had traveled to Europe. Currently, no countries have reported sustained community transmission. What it is critical and what is important is for our ministries of health throughout the region to be able to promptly identify those clusters of cases and promptly initiate those strategies that will reduce that transmission. In terms of second theme, Eric, as I mentioned, is what the U.S. Department of Health and Human Services is doing throughout Latin America and the Caribbean. HHS has offered bilateral technical assistance to affected countries in order to assist those individuals or that critical response effort and to prevent the further spread of the virus. As you know, the CDC, the Centers for Disease Control and Prevention, has offices in more than 60 countries around the world with over 800 staff. HHS, the Department of Health and Human Services, has received many requests for assistance, primarily around how do countries gather equipment such as personal protective equipment, PPE, test kits, medical equipment, disinfectants, how to best provide key messaging, trainings, data collection tools, but also equipment for screening at points of entry. Our U.S. Agency for International Development, or the USAID, is coordinating closely with the WHO in Geneva for any PPE or personal protective equipment requests. HHS is providing and has provided experts to the WHO, and CDC is coordinating with the Ministries of Health and with the WHO on mechanisms to respond to the epidemic. HHS is also coordinating with our colleagues, the Pan American Health Organization, who are in our region conducting regional trainings around laboratory training, but also around testing, biosafety procedures, how to transport some of these samples, surveillance practice, and of course, risk communications. We understand that Venezuela was provided test kits as well and training to its staff and National Institute of Hygiene. The U.S. government does indeed stand ready to support and provide assistance to the people of Venezuela. We are working with the neighboring countries, which are already receiving the influx of forcibly displaced Venezolanos. As you know, HHS Secretary Alex Azar has been a leader addressing the regional public health crisis brought on by the mass exodus of Venezuelans throughout the region. And finally, in these times of, as I mentioned, of technology and telework, telehealth, how can Latin America and the Caribbean get through this pandemic in the modern era? In the past 2 decades, I have been a responder in various public health emergencies of international concern, or as WHO coins them, PHEICs. This current situation or pandemic was, as declared yesterday, has come at a time of big data, of AI, of social media in Latin America and the Caribbean, and of course, WhatsApp. How do we utilize these tools? How do we best and most appropriately collect and gather all this information, maybe information overload, to assist appropriately our ministries of health to be able to filter appropriate health and essential health messages? We are currently evaluating promising initiatives that are being implemented with the private sector in other parts of the world to promptly share reliable public health messages in Espanol and in Portuguese, if needed, throughout the Americas. Thank you.
Nelson, thank you very much. And the reference you made to the Secretary and his leadership on Venezuela, I think is absolutely right. And for those of you who may recall, we actually hosted the Secretary, thanks in part to Nelson, your fine hand, to confirm it, but about a year ago to speak about the health crisis in Venezuela. So that program is also on our website for those who would care to review it. Regrettably, the circumstances have not gotten any better. In fact, they've deteriorated further. So, but I would call that to your attention. Before we go to the more economic side of things with Inez, would any of the 3 panelists who have spoken to this point care to give an example of a country who's been doing things particularly well in this context? Or if you don't want to point out a particular country, maybe certain things, procedures or policies that countries have put in place that from your perspective are particularly useful and could be considered best practices from the Latin America or Caribbean context? Dr. Barbosa.
Let me start. I don't want to point one country.
Okay,
We have
sure.
an
Yeah, sure.
assessment
Yeah.
that every country needs to perform a self-assessment about the core capacities to detect and respond to public health emergencies under the international health regulation. And we receive from all the countries in the Americas, including Latin America and Caribbean for sure, this self-assessment, but we also make an assessment based on the national plans that they have to face an influenza pandemic. So we can see that they have some strength. I think that the situation now is much better than 10 years ago, but we still have some important gaps. And we are directing our technical support trying to bridge these gaps. We have provided so far training and equipment for 29 national laboratories for COVID-19 detection. The Americas, we were the first region of the 6 WHO regions to have national capacity to detect the COVID influenza, including Venezuela. In some countries, we have them in a sub-regional training in Brazil for South America, in Mexico for Central America, but in the Caribbean, Venezuela, Cuba, and other countries, we deployed a team to that. We also deployed teams of experts on infection prevention and control and the reorganization of the health service to 17 priority countries. The countries that have the weakest health systems in Central America, South America, and the Caribbean. The Caribbean has a very specific situation because they are a small island.
Yep.
Their economic situation is much related to tourism, so they are very concerned to have a cruise with 1,000 people infected that 200 will need hospitalization. So we are in a very close dialogue with not only the ministers of health through our country office, but even the presidents that they are asking for some technical guidance about what they need to do. We are also recommending that the countries needed to be prepared, so we deployed for every country in Latin America and the Caribbean a kit of personal protection equipment so they can handle the first cluster of cases, but we encourage them to purchase. A couple of weeks ago, we told them, purchase what you can, because probably you will have a shortage of this kind of equipment. And also providing and sharing technical information. We had 2 ministerial meetings, virtual ministerial meetings, also some briefings to the missions, permanent missions here in Washington, D.C., and their daily contact with the focal points at the Ministry of Health. So I think that this kind of solidarity among the countries now, I think that they are very important because indeed to contain and to mitigate the burden on morbidity or mortality of this pandemic, we need to work together.
And I think it's really important, the points you're making, and the other panelists have made it too, that each country is different and they have to assess differently and there are different stages of development, et cetera. So I think that's a very important point, so thank you for highlighting that again. Other comments before we go to the economic side?
One comment that I would like to add is that, for example, in this exercise that the WHO and PAHO does, identifying the core capabilities of the country, help us to identify where we need to help and which countries we need to prioritize for investments. And this is very important because that also makes us think on what is called the One Health approach, in which it represents a collaborative approach for strengthening systems to prevent, to prepare, detect, respond, but also recover from primary infectious diseases and related issues such as the antimicrobial resistance that threaten human health, animal health, and environmental health collectively. In other words, epidemics like this is the moment that also makes us learn. It happens with SARS, with H1N1, and from there the bank has been working towards this One Health approach, in which is not just to think about the response, but to think about what do we need to do in a different manner, in which we'll also consider the environment and the animals, the zoonosis, that link between the animal health, the environment, and the human health. No, doesn't mean that we don't overlook how to support the health systems and how to make them more responsive for the cases, but also allows us to think what is coming for the future, where do we need to really strengthen those core areas where the countries need to respond.
Do you have any learnings? Perhaps you mentioned SARS, you mentioned H1N1. The last health scare I think that came across the region was really Zika virus. Are there key learnings, or is it just so different that it's not really applicable in this current environment? Things that maybe we learned from the Zika outbreak that we can apply now in a positive way.
There are, and here Dr. Barbosa could be better equipped than I will be to the specificities, but there are similarities in which the countries should be prepared, like the surveillance systems. On which point do we detect? But every disease has its particularities. In Zika, we were terrified for the transmission mother to child.
Yes.
In this disease, it has not been tested, it has not been proved. It has been tested, it has been examined, and it seems that the transmission goes at the neonatal level. In other words, when the baby is already born, but no a transmission from the mother to the kid. So diseases are different peculiarities, and with that, different ways that we need to react.
Yeah, no, that's a fair point. Dr. Arboleda, a comment one way or the other in terms of the regional preparedness, responsiveness, best practices?
Yes, Eric, thank you. I would say, we probably don't have enough time to go through the many lessons learned or positives to this point in terms of collaboration with certain countries. But I think over the last few weeks, we've had extensive communications to begin to prepare, to begin to share data. For example, with Mexico, with Colombia, with Brazil, who identified one of the first, the initial cases in the region, and who are beginning to prepare their laboratories, their staff, etc., and the National Public Health Institutes. As Jarbas mentioned, there are certain leaders, and we applaud that in the region, who've actually conducted some of the trainings and invited certain countries to receive and to share that information, which has been critical to this point. I would also echo what our colleagues from the World Bank are stating in regards to the preparedness part. There are areas within the international health regulations, and of course in the last couple of years, what has prompted to augment that has been the global health security agenda, for example. For each country, do a self-assessment. What areas do I need to improve in order to detect and to prevent and respond appropriately to these events? So certain countries have actually improved those capacities and will continue to do so. So I think those are some positives we see so far.
Terrific. No, thank you. And, we always get wrapped up in the crisis and the difficult things, and obviously that's a real concern, but sometimes we miss some of the positive things that have been happening too, and I think it's important to highlight those where we can find them. Indeed, to give hope and best practices and examples to others to try to follow as well. Well, Inez, 2020 was going to be a difficult year economically for many countries in the region already before coronavirus, and now we have this heavy weight that's now weighing down regional economies, indeed the global economy. From the ECLAC perspective, what are your all thoughts in terms of how this is going to progress and what's going to be the impact in 2020 on the regional economies?
Well, thank you. Thank you, Eric. Thank you, Zoe, for the kind invitation to be here this afternoon with my colleagues. And it's of course, a very timely discussion. Listening to my colleagues, it's clear that we've learned a lot. And there's some things that are known about this virus, but there's also a lot of uncertainty, and that's what I got from listening to them, and that translates also into the global economic situation as well as to the impact that this will have on the region. I guess there's still a huge amount of uncertainty, and it is too early to understand the complete impact of this virus on the world economy, on the region, and because we do not know the duration of the shock. And it's an external shock. And relative to other shocks that the world economy has gone through and the region, it's different because it's quite unusual because it's both a supply shock and at the same time a demand shock. A supply shock, and we've seen the disruption in terms of trade, we see the disruptions in global value chains, but also from the point of view of demand, We've seen traveling disruptions, lower consumption. So it's quite unusual, and these shocks are spreading quite fast. In terms of the global economy, different analysts and different international organizations are revising forecasts for global growth in 2020. And it is still not clear what the impact will be on the global economy, even though everyone agrees that there will be a slowdown in 2020. What is not also known right now is, assuming that this will end, what type of recovery will take place. And economists like to talk whether the recovery will be V-shaped or not V-shaped. In other words, was going to be a significant downturn, but then a speedy recovery or not. That is also an unknown, and that will have an impact on global growth. In terms of the region, this external shock is being transmitted through different channels. And the trade channel, in terms of trade channel, and financial channel. In terms, and it's both direct and indirect impact. In terms of the trade channel, well, the first impact is because the epicenter was in China, it's the direct, the trade relationship that the region has with China. 10% of the region's exports go to China, and 18% of the region's inputs come from China. So it's a substantial relationship. Of course, it varies significantly by country. In some countries, 30% of their exports go to China. So, of course, those countries that are more related to China will feel the impact harder. In terms of trade, there are several of the region's commodities, exports of commodities, that prices have plummeted. Already last year, there has been a decline of 5% in the terms of trade of the region. And now we've seen the decline in the prices of oil, the prices of copper, zinc, nickel, etc. So the link through terms of trade will also be significant for those countries that have natural resources as a main export. Now, also the issue of services and tourism, it was alluded before. In some countries, particularly some of the smaller countries, Caribbean countries, depend very much on tourism, and that will be disrupted. Already there are anecdotal evidence of cancellations, cruises, hotels, etc. And then the other channel is financial conditions. And if we've been looking at the newspaper and we follow what's happening in Wall Street and other financial markets, it has been extremely disruptive, and sell-off in equity markets, etc., and investor fears. And it comes at a time where, at least in the month of January, since December and through the month of January, it had been a good time for Latin American markets, Latin American bond issuers in terms of market. They had been able to issue a monthly record of debt. So this comes at a time that it's difficult. Now, what will be the impact on the region? Well, it depends on countries. Some countries have a higher refinancing needs, others do not. So the financial channel is very worrisome also for some countries, and we do not know what will happen in the months to come. In terms of our forecasts of growth in 2020, as you said, we expect growth to be lower than what we had estimated. Our forecast for 2020, we did this forecast in December, was for growth to be 1.3% for the region as a whole. And it was somewhat of a recovery relative to 2019. Our estimates for 2019 of growth was 0.1%. So it's very insufficient growth. And we have not adjusted our forecasts yet, and we'll see what happens throughout the year. But in terms of growth, it's very worrisome, because since 2014, the region had been having a very low growth. And as a matter of fact, between 2014 and 2020, it was 6-7 years of very low growth, and with a decline of GDP per capita of 3.7%. So it's something very worrisome. Of course, countries are in different conditions in order to face this external shock. And once I want to finish with this uncertainty. We do not know what the recovery will be. Will this just be sort of a first quarter, second quarter decline, and maybe towards the second part of the year there's going to be a recovery. That hopefully, I mean, we hope that would be the case, but we do not know what the outcome will be.
I think the word uncertainty is absolutely right, and the problem is investors hate uncertainty.
Yeah.
And so the more uncertainty there is, the more people say, well, I'm just going to wait and see what develops. But that's precisely the worst thing that can happen for developing markets. No, they need it. Everybody needs investment, but I mean, those investment flows are so important. As you were talking about the time period from 2014 to now, I can't help but think that the economic sluggishness across the region, and again, this is a omnibus number. Every country is slightly different, of course, but that obviously has political implications too, doesn't it? And to the extent that the region is going to have even slower growth this year, I'm not going to ask you to comment on this, but this could certainly play into some of the political scenarios that we're seeing in the region as well. So it's something that has very important implications. Inez, let me ask you in terms of mitigation of risk. So you've pointed out to some of the, particularly in the financial transmission, I mean, there is a real risk, there's a real downside risk here, obviously, and you've appropriately pointed to that. Are there steps that the governments, that the multilaterals, that other institutions, private investors, may be taking to try to put a floor under some of the problems and maybe restore confidence in some way? Tell us a little bit about that to the extent you're able to.
Yeah, as you mentioned, I mean, the response has to be both at the national level and you said at the international level. And at the national level, what we're seeing is that countries are active and vigilant, and measures taken by countries have varied from one to the other. In some countries, they have installed a gabinete de emergencia. So they are trying to be on top of things and taking measures, both at the level of to protecting the population health, and already the doctors here have alluded to that, but also in terms of how to deal with this economic external shock. In some cases, they are trying to reduce spending, but that comes at a time that is quite complicated, because there's in some countries have not very much maneuvering room from the point of view of fiscal policy, because they had been embarked in fiscal consolidation, trying to reduce fiscal deficit. So it poses a dilemma from the point of view of monetary policy. What has happened, and you said about investors being fearful, we've seen that because of that fear of investors, there has been currency depreciations, and that also creates a dilemma. Already interest rates are low, and currencies are depreciating, and you want to sort of play around trying to stimulate the economy, but at the same time try to preserve macro-financial stability. So measures have varied. In some cases, they're trying to reduce fiscal spending. In others, they are trying to protect the population and creating a fund in order to deal with the social effects of that. So we see a variety of measures being undertaken.
Terrific, thank you.
And sorry, let me
Please.
mention something. You mentioned the word international community. The response of the international community is absolutely crucial. Already my colleague from the World Bank mentioned the response of the World Bank, and the IMF has also responded. And if we think about the response of the international community during 2008 financial crisis, the multilateral banks and the financial community responded in a way that made a difference to emerging markets. So the response of the international community with credit, with financial resources, etc., is key.
Yeah, that's a great point. Thank you. So we've got a short amount of time remaining, and I'd like to ask each of you the same question from your own perspective. And again, to the extent you're comfortable doing it, we'll just start with Dr. Barbosa and go down the table. From your perspective, what is the one thing that leaders across Latin America and the Caribbean should be doing right now to address this crisis? We've talked a lot about a lot of different things, but if you were sitting in the presidency of pick your country, it doesn't matter, or the ministerial, what would you advise? What should country X, country Y, country Z, what should they be doing right now to mitigate the potential for even worse complications from coronavirus? Dr. Barbosa.
Thank you. We are saying, I think that some key messages to the health authorities. First, create wide partnerships. Health sector cannot face this challenge alone. So it's very important that in some countries the president, the head of states are themselves taking the lead and establishing broader mechanisms to putting together tourism, education, army, everyone to work together. I think that this is important. Second, to avoid overreacting. I think that we have a kind of, some people call this infodemic, because we have many news around and people are getting information from untrusted sources, and I think that this is very important to the social behavior.
Yeah.
Because we cannot have people that don't need to go to hospitals and emergency rooms, because maybe they will get the disease there, and maybe they will overwhelm the services, and people that are really needy will not get the services. And then focus on doing a few vital things well. First, protect your health professional. I think that this is very important. We need to prevent any kind of outbreaks in health services. I think that they contribute to the fear among the population. They can put a problem for the health service to keep working. Second, to reorganize your health system. So be prepared. Be prepared. Take the worst flu season that you had, and try to think about how we handle that situation, how we were prepared, how we postpone non-emergency surgeries, for instance, to have more critical care unit beds available and respirators and other. And also to start discussing with other sectors about the moment and the measures that you need to adopt to reduce the transmission. School closures, mass gatherings, and others. And I just wanted to highlight that we need to work together, the international community. This is very important. I think that the United Nations system, they work together. Here, this table, we had meetings with the World Bank, with the Inter-American Development Bank. As Nelson mentioned, many important initiatives that the U.S. government is performing in a bilateral, but not only this. The United States is not only a valued member of IPARO, but also a very important partner of our support to the countries through the CDC, the USAID. So I think that this is real crucial.
Very good. And you mentioned the IDB. We invited the IDB and they were unable to participate today because, well, for obvious reasons. They were very busy, as all of you are too. So, but we did reach out to them. Dr. Gordillo Tovar, to you, please.
Yeah, as I had said before, and doing echo of, I think, all the panelists thinking, the work, the integrated work and collaborative work of the international community is very key. But also the collaborative efforts of countries among countries, because in the what we call the South-South exchange, one country helping the other country. At this point, everybody is overwhelmed. The main element we think that should be taken care into account is to protect the health workers, the health human resources, because they are the pillar to be able to provide attention. However, I think that countries should not lose the light at the end of the tunnel, and despite of the emergency, think of the issues, where are the gaps, and how can we make it better? Because we are reacting, but we also have to think about, in the investment, during the reaction and the reactive moment, what can be made sustainable? How can we understand, what can we learn from this experience that could be sustainable for the longer term? We cannot give ourselves the luxury of doing investments or filling in gaps that are not going to be there to last. So I think that is one of the main important things. That is what we try to have behind the approach and behind our efforts, and in our effort to work collaboratively with PAHO, working with each country, identifying the gaps, the needs, and how we move forward for the emergency, but forward to sustain and strengthen health system.
Very good, thank you. Nelson?
Eric, will you like to ask us those tough questions? You know,
That's how we all earn our money, right?
if there was one thing that we could advise or provide guidance onto a president in America or a ministro de salud. It sounds easy, but it's hard. I came up with 4 real quick, but I'm going to stick with one. And that is probably the message that our director from the NIH, which you've probably seen quite a bit over the last few days, Dr. Anthony Fauci said, which is flatten the curve. Bajemos la curva.
That's it, yeah.
That's the message I would give to the Minister of Health. Bajemos la curva. How can we dilatar the situation, the number of cases, so they won't overwhelm our public health systems?
And the way to do that is social distancing, no large groups, all these things we've been talking about, yes?
Exactly.
Or are there other secrets?
Exactly. That's it pretty much.
Uh-huh.
How to reduce that transmission.
Reduce the
But they are
transmission.
doing that. Five countries have closed the schools.
Yeah, but you know the secret is when to do that, because some countries that don't have widespread community transmission, if they close the school now, they will produce a social impact, and when they need to do that, maybe in a couple of weeks, people will say, okay, but we closed it
reduce
3
the
weeks
measure.
ago and there was no effect, so they need to use it in a very surgical way,
Correct.
in the proper moment. So this is a challenge.
Difficult issues indeed. Inez, something from the financial perspective or economic perspective the countries can be doing now to mitigate the risk, if it's not too late.
I would say protect the most vulnerable.
Okay, yeah.
And because we know that any type of shock affects the population in different ways. It's generally the people that are most vulnerable, the ones that are mostly affected. But so dedicate resources to protect the most vulnerable, but at the same time, so focus on the short term, but at the same time with an eye towards a medium and long term. Remember that we need to strengthen growth in our economy. So any type of short-run measure needs to be accompanied with measures to foster growth in the future.
Do you see, from an economic perspective, countries taking steps to pull back? For example, taking protectionist measures? It's not exactly that type of thing, but when you close things like airports and flights and things like that for health reasons, that also has a dramatic economic impact. Are there things that can be done to try to keep trade flows going that do not negatively impact the health side? How do you strike that balance? It's a very difficult thing, no?
And Dr. Barbosa has talked about,
Yeah.
use the word balance, and
Yeah,
you're using it
yeah,
again.
yeah.
Exactly. Having the right balance. You have to take some short-run measures.
Yeah.
But at the same time, I think all countries are clear that a resumption of trade and growth, etc., is key. So,
It is key.
yeah.
Indeed, for all
Yeah.
countries, including the United States. Ladies and gentlemen, this has been a fabulous conversation, if I can say so. I hope you think so as well. This is not going to be the last time we'll be doing webcasting for our programs. Unfortunately, going forward, it looks as if big meetings and close meetings and the things one would normally do may be circumscribed, at least for the brief period of time. And so look for further opportunities to tune in via webcast to the Council of the Americas. Normally at this stage of the program, I would ask for our audience to thank our guests for their terrific comments, their expertise, and their presence here today during a very busy time. We are unable to do that because we don't have a live audience, but I will offer thanks on behalf of all who were tuning in, and as I say, there were at least several thousand. And the program will be available on the website afterwards as well, so people who weren't able to tune in live will be able to watch it to the extent they care to. Thank you. This has been terrific. I know there are lots of questions we didn't get to. I know there are lots of things each one of you wanted to mention. We're just circumscribed by time, but I hope each one of you will come back. This issue, I hope, goes away soon, but in case it doesn't, please come back and give us an update. Thank you very much.
Thank you.
thank
Thank
you.
you for having us.